This is a really exciting time for myeloma therapy, and really what I see is a revolution in how we approach the disease. For the last number of years, the focus has been really on the development of novel biologic therapies. And we know that the overall landscape changed quite a bit with the introduction of proteasome inhibitors, immunomodulatory therapy, and the ability to really better reduce disease burden in patients than we were able to achieve with chemotherapy. That led to better outcomes in both therapy with those agents alone, as well as the incorporation of those therapies as a strategy leading up to transplant. One of the questions that we have addressed is whether the more effective biologic therapies would actually replace the need for transplant. That remains an active issue of discussion, but at least some of the preliminary data suggests that transplant still has a very important role with this disease. The frustration is that even with these newer agents and the better ability to reduce disease burden, the development of second and third generation proteasome inhibitors or immune modulatory drugs have further expanded our ability to treat patients. But we still tend to run into this wall, ultimately, of progressive disease. There's been a real interest now in trying to explore how the immune system may impact the disease and be used as a tool to treat myeloma. And there are a couple of different approaches in exploring that. One is antibody therapy and the use of certain targets on myeloma cells to distinguish them from normal cells. These include targets such as CS1 that elotuzumab goes after, CD38 that daratumumab targets. And those agents appear to have an increasing role in the sort of armamentarium of how we treat the disease. They may be effective alone, or as we saw with elotuzumab, in combination with other agents such as immunomodulatory drugs. There's also a real interest in how to develop T-cell therapies or other effector cells to target myeloma cells. One of those sort of efforts has been the idea of targeting PD-1, which is an important tolerizing pathway that prevents the immune system from effectively seeing myeloma cells as foreign. By blocking that pathway, one could unleash a native immune response, and this has been extremely effective in certain diseases. We are now learning about what its role is in hematologic malignancies. It may be that just undoing one pathway like that is not enough, and that this needs to be brought in combination with other approaches to expand immunity. One of those ideas is the use of tumor vaccines. We, as a group, have explored the use of a particular approach where we create a fusion between dendritic cells and the patient's own myeloma cells, and have been shown this can induce a powerful immune response against myeloma and the conversion from partial to complete responses. And we've seen now interest in exploring a national trial that will randomize patients post-transplant to receive a vaccine or just lenalidomide maintenance alone. There's also a tremendous interest in the use of T cells as effector cells themselves with the revolution in CAR therapy. These represent efforts to put antibodies into and graft them into T cells so that they can better recognize targets. There's been fantastic success in acute lymphocytic leukemia. And we're now exploring how we can construct these types of T cells to target myeloma-specific antigens, and that work is ongoing. What we've learned over time is that myeloma is a very complex disease, and if one wants to effectively target it, and hopefully with the long-term goal of eliminating it, one has to sort of embrace that complexity and hit the disease from different angles. So what we've seen is that the immune modulatory drugs and proteasome inhibitors are one approach to doing that. How they then integrate with the immune system and its interaction with the disease and figuring how to repair that, and how that integrates with other approaches such as transplant. I think all of those pieces are going to come together for the future. Right now what we've done is looked a lot at sequential therapies to control the disease. I think that if we integrate these approaches, particularly harness the power of the immune system, we could potentially cure this disease.